c'est rare ces derniers temps d'avoir de bonnes nouvelles en matière d'immigration ici au Canada. 5000 places uniquement réservées aux médecins dans le programme de nominés. 14 jours, c'est le temps que mettra le traitement d'un permis de travail pour les médecins. 14 jours seulement. Est-ce que vous imaginez ce que ça veut dire? Un nouveau programme entrée express uniquement dédié aux médecins. Alors, ça, ce sont les points principaux de l'annonce qu'a faite le ministre fédéral de l'immigration ici au Canada ce matin. Je vous laisse tout d'abord suivre ce que le ministre fédéral avait à dire et je vous retrouve juste après.
Merci à toutes et à tous d'être ici aujourd'hui et bienvenue tout le monde. First, I've already thanked my colleague Leslie Church, the Member of Parliament for Toronto St. Paul's, who's also the Parliamentary Secretary to the Secretaries of State for Labour, for Seniors, for Children, for Youth, and Minister of Jobs and Families. Of course, welcome to my colleague, Parliamentary Secretary for Health, Ms. Maggie Chi. Thank you for the important work for supporting Canada's health system. And you will speak right after me, so that's great. I'm also grateful today to the University Health Network for hosting us, and to everyone who's taken the time to participate in today's announcement. So Dr. Catherine Tinkham, thank you very much, Physician-in-Chief here at the University Health Network, and to Dr. Margot Burnell for flying here, President of the Canadian Medical Association. So we're meeting today, in the month of December 2025, so near the end of a long 2025 year. And we know that for Canada's healthcare system, the last several years, particularly since COVID, things have not been easy. Nous sommes ici près de la fin d'une longue année et nous savons que les dernières années ont été difficiles pour le système de santé du Canada. Nous avons vu la pression dans les urgences, nous entendons les familles qui attendent un médecin et nous voyons le personnel de première ligne qui est très fatigué. So we've seen the strain in our emergency rooms. We hear it from families waiting for a doctor, and we feel it from the frontline staff who are stretched thin. In fact, I actually flew in yesterday and I attended Mass in Toronto, and one of the parishioners came to me afterwards, who was a healthcare worker, and said to me, I'm doing 3 shifts in the hospital in Toronto. Thank you. I heard you're doing something tomorrow morning about that. So we hear it, we see it, we know it's there all across Canada. There is no single solution, and while credentialing and licensing are under provincial authority and professional regulators, as Minister of Immigration, I know the federal government still has a role to play, a very important role. As such, our government has been adjusting immigration levels to bring the system back into balance and reduce pressures on our services and communities. But a balanced system is also a responsive one. Notre gouvernement ajuste les niveaux d'immigration pour ramener le système à l'équilibre et réduire la pression sur nos services et nos communautés. Mais un système équilibré doit aussi être flexible. It means that as we return to sustainable levels, we must simultaneously attract the high-skilled talent that will help relieve those pressures, particularly in key sectors like healthcare. We've heard a clear message from patients, provinces, and the medical community we need more hands on deck. There are qualified doctors, many here in Canada, on temporary status, and some abroad, who are eager to serve Canadians. Yet too often, they face barriers, delays, and uncertainty. Beaucoup de médecins qualifiés, plusieurs déjà ici avec un statut temporaire, d'autres à l'étranger, veulent travailler. Mais trop souvent, ils font face à des obstacles, des délais et de l'incertitude. Over the last few months, I asked, the departments asked, our provincial and territorial partners, what do you need from us to get doctors working faster? Their answer is clear. Give us the space to recruit, give doctors the certainty to stay, and move at the speed of the crisis. This is why today is an exciting day, because today we are answering that call. Je suis heureuse d'annoncer plusieurs mesures pour recruter les médecins dont nous avons besoin, garder ceux que nous avons déjà et accélérer les délais de traitement. So today I'm pleased to announce a suite of new measures to recruit the doctors we need, to retain the ones we have, and to cut processing times to ensure it all gets done quickly. So these are three important things, and let me just explain to you what that means. First, we are empowering the provinces and the territories. These are my provincial and territorial colleagues that I have been working with for the last 6-7 months. We know Canada needs more doctors, but healthcare needs look different in downtown Toronto than in rural Saskatchewan. Provinces and territories are best placed to determine where their pressures are greatest. So, we are reserving 5,000 federal admission spaces for provinces and territories to nominate licensed doctors who hold job offers. Nous réservons donc 5,000 places fédérales pour que les provinces et territoires puissent choisir des médecins autorisés qui ont une offre d'emploi. These are dedicated spaces over and above the annual allocations. So when a province or territory finds a qualified doctor, federal caps will not be a barrier. We are giving them the room they need to staff up. Second, deuxièmement, we are deploying federal tools to support this effort. We are launching a new express entry category specifically for international doctors with at least 1 year of Canadian work experience in the present years. Nous créons une nouvelle catégorie entrée express spécialement pour les médecins internationaux qui ont 1 mois, 1 an d'expérience de travail au Canada dans les 3 dernières années. Many of these doctors are already treating patients in our communities. We cannot afford to lose them. So today's announcement will open the door for eligible doctors who are already here to create or update their express entry profile now before we start sending invitations to apply in 2026. It signals to every doctor here temporarily that we value you and we want you to stay. C'est un message clair pour tous les médecins ici temporairement. Nous vous apprécions et nous voulons que vous restez. This measure is Canada's international talent attraction strategy in action, which we have announced in Budget 2025. It reflects a levels plan that is targeted, that is streamlined and that is responsive. Elle montre que notre plan de niveau d'immigration est ciblé, efficace et flexible. It ensures that we restore balance to the immigration system, that we are laser focused on locking in the essential talent that drives our economy and keeps our social infrastructure strong. Thirdly, as I said, there's 3 items. Thirdly, and effective immediately, for provincially selected doctors, we are offering expedited processing of work permits. And I can tell you that's a big deal. A doctor will be able to secure a job, get nominated by a province or territory, and have their work permit processed in just 14 days, allowing them to focus on what matters, treating patients while they wait for permanent residency. So, un médecin pourra obtenir un emploi, recevoir la nomination de la province et faire traiter son permis de travail en seulement 14 jours pour qu'il puisse se concentrer sur les patients en attendant la résidence permanente. This targeted approach builds on the work we recently did to attract and retain international graduates. So just as we refined our tools to keep the bright graduate students our economy needs, we are applying that same precision here. We're moving away from a one-size-fits-all approach toward an immigration system that targets the professional Canada needs most.
Avant de voir comment va se traduire ou bien comment vont se traduire ces annonces-là qui ont été faites ce matin par le ministre fédéral, nous ne pouvons qu'espérer que les choses aillent pour le mieux en matière d'immigration ici au Canada. Alors, si toi aussi tu as suivi toutes ces annonces du ministre fédéral de l'immigration, dis-moi en commentaire ce que tu penses et fera un plaisir de te lire. Merci d'avoir suivi cette vidéo et je vous retrouve sur une prochaine vidéo. À bientôt!